Let's begin by welcoming everyone to the Siren Racial Health Equity in Social Care 2022 National Research Meeting. Before we begin, I would like to go back one slide, please, so that we can talk about the agreements that we have. We want to be sure that people are comfortable talking about racial equity and that we have an opportunity to practice active listening, that we can agree to disagree, and that we are mindful of the power dynamic and acknowledge our habits of judgment so that we can relax our judgment for this hour and try to understand what is being communicated. Next slide, please. So this is Comfort Homesake and our take on modern day elderhood. Next slide. It is my pleasure to introduce our guiding elder, Sister Iya Tahirah.
Greetings and good afternoon to all of you who have showed up here. And I am most delighted to be sitting on this platform as your guiding, and also to mimic what it might look like for the modern day elder to go forward. I'm not saying I'm totally it, but I think it's a challenge to be in this time phase. So I'd just like to begin acknowledging our theme, which is on elderhood. And what it brings is me to the question of what is historically has been the role of elders in the world and in our community. So this first question brings me to ask that of all of us, what has been the role of our historical elder? Not the elder that we see that is defined by modernity to be elderly, someone who is disabled, someone who is not able to fend for themselves. So I'm just trying to get us to lean into that question of what is it to be the true elder in our modern day culture, and allow that to sort of marinate inside of us, because we all will, if we live long enough, we will come to that question of what is it I'm to do right now that I'm standing at this threshold of what we call elder. I'm told that those elders that lived in our old indigenous culture were prepared to serve in the role of elders. They was the ones who had, in fact, indeed, it was part of the maturation to be able to go through these stages, first to live as the adult, and gather the experience of being the adult, to raise their families, and to derive from that the wisdom that they would need to recalibrate and lead forward and leave in place a new pattern, or the pattern of elderhood for the generation to come. As we know, in our past history circumstances of colonialism and modernity, we are not living in a state of harmony with a collaborative community of elders, of people who work together for wholeness. In fact, on a daily basis, we are witnessing terror and emergency violence in our communities, and illness that threatens the elder community. And by and large, those who are there to protect us are sometimes seen as part of the problem. However, as we attempt to weave a modern day elder council in place, we will come to see our ancient cultures relied on the elders as the storytellers, the wisdom keepers, the weavers of what had gone forward. They were less inclined to serve in a political position or social leadership. Theirs was the concern of the deep healing and knowledge and contribution they had derived from their own living, they would lead to their future generation and the world around them. They were prepared by their survivor, by all the trauma that they had suffered, and had a willingness to gather from that the wisdom and understanding of what that meant and how it had brought them to this place of transformation, not just for themselves, but for their generation and for the community that they would leave in place. Led by wisdom, what was it that they did? They was prepared to chart a course for a different future and a different kind of existence for their generation to come. So unfortunately, in our today's society, we lack the kind of knowledge or wisdom I here speak of. Most often, we derive an understanding of elders from what modernity has given us and how modernity has defined us. As such, we found that those people who hold the wisdom are locked away in design beautiful landscapes called independent living and nursing home. Along with them, their gifts and their wisdom is locked away. As we progress through the rubbish left by the past history, let us chart a new course by turning to those who just may hold the answer that we need today. Let us turn to those who are locked into these beautiful design buildings and ask them for their wisdom. Ask them what it is that they see that we need to do to guide ourselves forward. Let us look into our past history. Let us turn to our past history and ask ourselves, what have we learned? What is a gift that we individually and collectively can bring forward at this time? Turning to our history doesn't mean that we live there. We do not live the victimization. We do not live the judgment. We do not live the blame. We derive the wisdom by turning to our own individual culture, to our own individual journey, whether we're white or black. What lessons have we learned along the way that will help us chart this new course? I invite each one of us to turn there because the gift lies within us. It brings me to an idea of the alchemist's journey. The alchemist takes to the road to discover this most secret part that lies in turning lead into gold. He goes through the badlands. He faces the storms and all of the darkness that meet him on his way. And eventually he arrives at his destination. And arriving at his destination, guess what? He found that that very thing that he had been seeking lies right there within him. So I invite you to think that the answer that you seek to chart the new course, to derive new data that would allow you to go forward, turn to those who may, turn to yourself first, and then turn to those who may hold the secret, those who we have held as inadequate to chart the course for themselves. But think, have we asked them? Have we made the effort to go to them? Or have we just derived a definition that lies outside of their own personal experience and determined that they was inadequate based on some definition, someone else defining their story? Let's go ask them, what do they now know? It brings me again to my childhood growing up in Mississippi. Those elders that exist there. And my first encounter with the N-word I'm riding on a bus in the high school. First time I'm leaving that village, sort of village that I lived in. And on this bus, these yellow buses, we all returning home. And my white body fellow people turned and they was calling me the N-word. What is the N-word? It was like the first time I had heard the N-word. So I ran home with tears in my eyes and I asked my great-grandmother to tell me about the N-word. I don't even know if she really knew, had a meaning for the N-word, but what she turned to me and said, daughter, hate for hate gets nothing but hate. Those people themselves have difficulty in loving themselves and they themselves do not know what love is. And there was many instances through storytelling of these elders who planted what I call these droplets and seeds of wisdom that would help me chart my way through the course of a racial charged America. Of course, at the time, I wasn't able to know that, but I met those droplets. I met that wisdom as I moved through life. So through our storytelling and through retelling our story and revisiting our history, we come to know those things that brought us here. And sometimes we will find, maybe from your grandmother's table, or some droplets of wisdom that helped you to make your way to this place today. So let us draw upon those experiences that we have had in our culture to chart a new course, to create a new model for going forward. Let it become our map to take us forward. So in closing, my dear friend, I want to bid you well in the voices of my ancestors by appreciating you for being here. And hopefully I have said something that will spike you to utilize your imagination to imagine what would it be like? What would it be like? What could it feel like to be in a community where we relied on those who had lived the experience, those who may be able to come back and tell us how to overcome some of the racial divides and conflicts that we face today. They may inspire us to look again beyond our laboratories, beyond our prepared answers, but go with a question. Because if we think we know the answer, we may not. We may really miss the lessons by not asking the question. What is it that I have learned? What is it that I bring forth today that will help us chart a new course on these American soils? And again, in the voice of our ancestors, Modupe O, Ashe, Ashe O. I thank you for being here. Ashe.
Thank you, Iya. I'm going to go next and just take the modern day elderhood construct that guiding elder Iya Tahirah just introduced and discuss opportunities to promote health equity with elders guiding research and program partnerships from the ground up. Next slide. As we discuss equity in healthcare for African Americans, we begin by acknowledging that racism is the root cause of racial health inequities. When we look at serious illness, African Americans are diagnosed with serious illnesses at higher rates than their white counterparts and die at a younger age. They're less likely to be assessed for pain or receive effective pain management and experience lower quality clinician communication. They are more likely to have physicians underestimate their pain compared to white patients and less likely than patients of other races to have advanced care planning discussions or documents. Structural racism in healthcare. These are the policies, the plans, the practices that are the foundational cause that these disparities continue. I wanted to highlight one example. I'm just going to go back for one quick second there. So sorry. I also need to apologize. I did not allow for anyone to introduce me. I apologize. I'm Monique Parrish and one of the group here presenting today. An example of structural racism I wanted to highlight, which both tells this story, but also highlights an opportunity, as guiding elder Iya Tahirah mentioned, an opportunity to work with elders, is an example that is constructed through IRS with hospitals and health systems. And this actually has an endpoint, so forgive me and bear with me. It is called the Community Engagement Exchange. And in this Community Engagement Exchange, which was launched in the 1950s, hospitals and health systems with nonprofit tax status were able to receive tax exemptions in exchange for providing community benefit. And over years, that benefit has been expanded. So not just doing necessarily care for individuals who could not be pay, but also to provide care within communities. And again, we're going to hear this theme of communities and then opportunities to more meaningfully, equitably distribute power between communities and other entities. Along the way with this tax exemption status, there were a number of abuses. Specifically, over time, hospitals and health systems that were required to do this community benefit, including in 2012, had to conduct research. They had to do health needs assessment with community members, and they had to develop accompanying plans to actually implement the strategies to address those needs. Has fallen a little bit by the wayside because there's no teeth in that, meaning that there was no link back under the IRS. If you got this tax exemption, if you're a healthcare system or a chain, and you highlight in your structured needs assessment, there are the needs, and you might even indicate how you're going to address it, you're not required to spend any of that money, that community benefit spending. And in 2017, there was a study that looked at urban hospitals and found those that have nonprofit tax status, that 65% of those hospitals had highlighted disparities and inequities with the communities they're serving. 9% actually had strategies to address it. Fast forward just 2 days ago in the New York Times, there was an article that highlighted a large national healthcare chain, Bon Secours Mercy Health. The article is entitled, "How a Hospital Chain Used a Poor Neighborhood to Turn Huge Profits." The hospital, which is called Richmond Community Health, was bought out by this national chain. And it was Richmond Community Health is serving a predominantly African-American community. What they discovered in this expose is that the health system was buying drugs at this enormous discount, charging patients' insurers full price, and not using this money for community benefits. Next slide. This expose may have been written as a result of the COVID-19 pandemic, which brought many of the health inequities and outcomes into focus for a broader segment of the American population, and with it, the urgent call to transform our healthcare system. I wanted to highlight there are some changes underway. And as we've heard from a number of presenters with this conference, moving up to the levers of power in order to make changes is an imperative. I wanted to highlight that some of these changes that are underway are with the Centers for Medicare and Medicaid Services, which is the single largest payer for healthcare in the United States. With their innovation center, which is tasked with testing payment models and really promoting models that have quality care, they've elevated advancing health equity to the top. They have a Health Equity Action Task Force. Their focus is on community health and meeting social needs. That's an example. I want to be mindful of the time, but there was a great presentation on day one by some researchers and analysts representing the Centers for Medicare and Medicaid Innovation that were looking at some of these test models and provided an opportunity to really target health equity. While racial minority populations were represented, less so in hospice models, and more importantly, they are looking at very creative ways as guiding elder Tahirah mentioned, to capture the story, to really capture data in a meaningful way. What I'd like to do is go ahead and I just have a quick note that California itself has a California Advancing and Innovating Medi-Cal program that is committed to addressing health inequities and outcomes disparities. Next slide. Comfort Homesake, which is advancing this construct and the opportunity to work with elders and elderhood councils in a meaningful way, is the foundation for re-engineering the power balance, addressing communities with a recognition of the beauty and the power and the strength, as Elder Guy Tahirah mentioned. It is really working with elders that can represent the community in terms of providing information and the story and the richness of how information support are shared, how generations engage, really focusing on African-American lived experience, both present day and over generations. And this means really recognizing and honoring the role of ancestors and ancestry. As storytellers and keepers of wisdom, this is a tremendous opportunity, and Comfort Homesake embraces this approach to working with communities and advancing the opportunity to recognize all of these strengths, and for over 15 years has been providing programs in the community that really holds this sacred. Next slide. I'd like to conclude my presentation with just a personal sharing. I was a former Peace Corps volunteer, lived in a small village in Africa, in the Central African Republic. And I had the extraordinary gift of not only developing a very special relationship with the elder in my community, where I was a guest member for 2 years, the chief of the village, but observing this council of elders comprised of both men and women who helped to celebrate village life, helped to address needs within the community. And when there were challenges that needed to be settled, they did that too. It remains one of the most cherished relationships in my life. And with that, I'd like to pass the baton to Dedoceo, my colleague.
Hello, everyone. Thank you all very much for taking time to participate in this very important series of conversations. My name is Dedoceo Habi, and I'll be talking about elder councils and healthcare. I am a community health advocate, and I focus on leveraging untapped powers of our elders to help build a stronger community. My perspective is that I am a community member who genuinely cares for our community, and I genuinely enjoy sharing. Now, I wanted to, wait a second, let me move down. Here we go, sorry. There we are. Yeah, so I want to make a disclaimer just to kind of be clear about some things. When we use the term elder, we're not referring to just the elder who is the elder in your church. And we're not referring to just the elder who is a senior member of your community. We're referring to the elder who lives in the community, who works on behalf of the community, and who has demonstrated a clear desire to help build a community by sharing his or her insights, expertise, and also being an intermediary between the various community entities, specifically also with regard to healthcare. So what's the big idea, right? That's it. What's the big idea behind this approach that we're referring to? Well, our approach is derived from a look at the African societies, specifically the role of the elders. In many African cultures, elders take a dominant role in community building and sustainability. They help the community realize its goals and mitigate problems. The American system, as we know, is very, very complicated. It's rooted in more of an individualized approach to healthcare delivery. Specifically, we have more hospitals to choose from, more providers to choose from different medicines, so on and so forth. The systems are different, yet we can benefit by integrating aspects of the African approach, the elders in community development to become better. We believe that by engaging elders as community liaisons to help mitigate issues around healthcare and maintain focus, everyone stands to benefit. We stand to benefit because this supports the delivery of services specific to a given community. If the elder lives in the community and engages and interacts with the community, they know what's going on and what the needs are. Elders can play a greater role in healthcare when they are included in a more comprehensive approach to healthcare concerns and service delivery. In truth, one size does not fit all, but there are common interests we can build from by bringing together all the resources, knowledge, and communal interests at the local level to give the community a sense of self-determination. Because at its heart, that's really what it's all about. I also want to kind of remind us about the social determinants of health. Of course, there are these 6 areas, and ultimately they work together to provide healthy or help predict health outcomes in the community. One of the things I want to focus on is the one that's highlighted here, which talks about the provider linguistics and cultural competency. It's clear that that is obviously something that's quite relevant that should be factored into all solutions that are engaged at the community level. I also want to, so I know this is a busy slide, but we asked the question, well, what could elders do to enhance community health care? And what would that look like? So we took the elements of a healthy community and mapped them out in accordance with the specific area and what that area would look like with an elder integrated as a liaison between community and healthcare. Now, what we found, of course, is that in every instance, the community benefits when elders are integrated into the equation. And ultimately, we believe that elders represent an untapped resource that all communities can leverage for their benefit. I want to kind of share this notion, this idea we had with you about the term gerontocracy. And we'd like to present something new. The old way of thinking about this term is it's a state, society, or group governed by old people, government based on rule by old people. That doesn't sound very positive or very productive. What we would like to suggest is that we tweak that a bit and say gerontocracy represents a state, society, or group governed by the wisdom of elders who continue to serve the community and guide it towards its goals. Government based on elder-informed wisdom for the benefit of all. So we think that by broadening this perspective, we get a better sense of what can be accomplished by engaging our elders. Quickly, I want to have a talk about a case study. Elderhood of Elders Network. This is a group that is very successful in working with community and for community. Some of the highlights are they are multi-generational. The youngest member may be 20, the oldest may be 80. They purposefully form alliances in myriad community entities, including political, healthcare, education, banking. They do all these different things to really help give voice to the needs of the community. They take an active role in identifying and mitigating challenges to communal livelihood and goals. They're fully committed to maintaining a lasting presence in the communities they serve. They leverage partnerships to bring issues and recommendations to community leadership, and they're anchored in the communities that they serve, making their perspective more relevant and timely. I happen to know one of the founders, a gentleman by the name of Arnold Perkins, who's a really great person. He's a former director of Alameda County Healthcare Department. And I've watched them as they worked the community through this particular organization. And I also want to mention that there are other organizations like this as well. And what I found most profound about this is the level of commitment they have to making sure that the voice of the elder is represented in the conversations with whether it's politicals or the healthcare conversations. It's proven to be very beneficial and very timely for the community. I've got a couple questions I'd like to leave with you all just to consider. The first question is, does a local city council function in the same way as an elder-led community entity? Just food for thought, something to consider. The next is, how do we overcome the systemic impediments that keeps us doing the same thing over and over again and expect different results? We know what that means. We've heard that one before. And also, an individual can become self-actualized, but can a community become self-actualized? And if so, what would that look like? Just some food for thought. I'd like to thank you for giving me the opportunity to share these thoughts with you. And I'm going to now move on.
Greetings, everyone. I am Marilyn Ababio. My attributes are intentionality and collaboration. I'm here to talk with you to share our vision for elderhood councils as a modern day construct. Next slide. There are many definitions of elderhood. The definition we chose was derived by focus groups and traditional elder interviews. It means to have lived life in post or navigation for those who come behind us. That means not passing on pain and suffering, but recalibrating experiences in such a way that others can transmute and heal. This definition is uniquely African American and is reflective of the needs of a people who suffered physical, mental, emotional, and spiritual abuse for hundreds of years. African Americans trust the elders who have accumulated influence and resources over the years. Those who have set examples of coordination and cooperation and collaboration. Those who have the ability to guide perspectives and bring hope and personal attachment to a better future. Next slide. We are not helpless. We understand the dynamics of power. There is the power over and the power with. The most important form of power is simply the power to do things. We offer a partnership with the research community that will shift the power dynamic using community-centric research techniques. This would include honoring the place of storytelling and using digital technology as a part of our oral history collection. The experience of Comfort Homesake professionals has well over 30 years engaging marginalized communities in environmental justice work. As an organization, Comfort Homesake has 15 years of culturally relevant experience interfacing with community leaders and elders, collecting data, writing results-based accountability reports. Community-based coordination can move things and generate powerful change. If we wish to associate power and community, the embodiment of a council of elders may be one solution. Next slide. During this plenary session, during the Siren plenary session, we heard about abolitionism. We seek to abolish the idea that African American communities have problems and we need to treat citizens as clients in need of services from government and nonprofits. Our methodology embraces asset-based community development, a process by which we realize that citizens are assets, that citizens can co-create their own community. We discover community assets by mapping real estate, identifying business and community-based organizations and individuals who are assets in that community within defining community within a particular geographic area. We can mobilize these assets via the cooperation and the collaboration of entities like an established elder council. Engagement with researchers might help community members understand how research will impact desirable outcomes both in the long and short term. Next slide. This is an example of how Elderhood Council has and can impact health and prosperity. I'm talking about the example that some may be familiar with called Black Wall Street. This is the Greenwood district of Tulsa, Oklahoma. The outcomes began with the investment by a Mr. Gurley, who purchased 40 acres with the intention to provide opportunity for African Americans migrating from the Deep South. The Elder Council instituted wage and education standards so that the community could be on par with whites. This is the equity. They instituted an income multiplier effect so that the money circulated in Black Wall Street 36 to 100 times before leaving that community. The elders practiced the art of community resource development and deployment and increased the community's health and wealth. The elders warn us of dangers, and they teach us from the lessons learned regarding racist political will, law enforcement discrimination, media stereotyping, and biased rhetoric. Although the Black Wall Street example takes place at a time when African Americans lived segregated from whites and therefore enjoyed community integrity, still, this example will allow us to draw out what the community did between 1906 and 1921 and glean what is a modern day elder council. What could they accomplish operating with cooperation and collaboration with, for example, a health system? More research and data collection will certainly help make the case for health elderhood councils. Next slide. I wish to lift up the Siren researchers' work. If we take a cursory look at the findings of 3 Siren social care research areas done in 2022, the research represents to me a start from which to revisit and expand with the perspective of asset-based community development with elderhood councils. The entire research can be found on the Siren website, and we will put it in the chat. Number 1, whole person health score research. These findings indicated that the community identified nutrition and lifestyle needs. When a community identifies its needs, can a health elder council coordinate resources to clarify and address nutrition? What would community elders say about lifestyles? The second research, clustering of social determinants of health. These findings identified this triad as most important: food insecurity, social isolation, and the inability to pay for housing or utilities. How can we support elderhood councils such that they can develop a long-term plan to teach families how to accumulate wealth and reduce poverty, perhaps not for this generation, but for the next? And our third example, patient preferences for discussing health-related needs in primary care settings. Those findings resulted in an understanding that the community, the people interviewed, were less comfortable discussing needs outside of traditional primary care. A council of elders who live in the community, who understand the pressures and the culture, could be a remarkable asset for providers and healthcare systems to pour into and provide health education, training, and perhaps learning themselves how to serve communities in times of pandemic, climate crisis, or other population level events. Next slide. In summary, Iya Tahirah provided you with a living example of elderhood. Dr. Parrish discussed the health system's approach to health equity. Mr. Dedoceo Habi talked about existing frameworks for elder-led councils and the impact that councils can have on the social determinants of health. Our goal is to partner with you and invest in asset-based community development as a framework for social care research. We are looking for an academic research partner and funding to understand what impact can an elder council have on community health. Let's imagine communities where growth and development is guided by connection and wisdom of our elders. Imagine a world where we don't discard knowledge and lives lived, but instead embrace what has come before as a path towards better lives to come. Next slide. I really want to thank our Comfort Homesake team and the Siren Group for this wonderful, insightful, informative conference on social care research. I'd like to thank each of you who attended this session for listening and reflecting on our proposal. This is our contact information for any of you who would like to do any follow-up. My personal contact information, as well as Comfort Homesake's information. Please visit our website at comforthomesake.com, and we greet you with good health to all. Thank you.
Thank you so much. That was fabulous. We have a few questions in the chat. I wonder if you might want to take a moment to answer, because we do have a few more minutes. I think there was a question around kind of if the panel can talk logistics and costs for facilitating this kind of work. Yeah, and how healthcare organizations can tap into elders' wisdom. And also, please feel free to, we're a small group, so please feel free to come off mute if you've got other questions and raise your hands. But maybe we can start with those. Like if a healthcare organization is interested in kind of connecting with elders in their community, how would they go about finding them, like a group of elders?
Well, I would simply say to begin by looking into the community. I have found with asset-based community development, one of the ways to address a particular community might be where a health system may look at a population within it could be people who are managing a chronic disease, people with certain cancers, and just kind of identify what zip codes they may be from, they may live in, and then look at what resources are in that community and reach out. And sometimes those resources are not obviously elder councils. They may be community-based organizations and associations, but if you start an inquiry, you'll find what you're looking for, or create one.
If I may, one of the things that we did, or that I did in preparing was research to kind of see what the landscape was like at a national level for elder-led councils, which actually sparked some questions. But nonetheless, the point is throughout the country, there are a number of different organizations that all work to serve community by engaging elders. So I would say you can also do some internet research on that. Sometimes you can also go to your local commissioners. Sometimes within the local city commission, there are elder-led groups that provide service to community.
This is Monique. I just wanted to emphasize very quickly that we already have a process in place by which hospitals and health systems are required to work with community members to do these needs health assessments. And then, of course, as I mentioned, develop this accompanying plan. And this is a beautiful and perfect opportunity to partner with elders in the community more broadly. And as Dedoceo said, there have been extraordinarily wonderful partnerships with faith-based communities and working with elders that go beyond just a faith-based community that, as even Elder Iya Tahirah had mentioned, those individuals living in assisted living facilities or skilled nursing facilities. So this is already something that's in place that really could be developed to have this connection to the community meaningfully.
And I'd like to add a word of caution that I think whatever staff is going to reach out to the community may need some culturally relevant training. It's been my experience that a lot of time health professionals, they talk in a certain way and they get nothing. So, so it's just a word of caution. And you can always contact Comfort Homesake. We work all over the country. We can help you.
I'd like to add another point there. I was initially, as I began this journey of developing elderhood in and around communities, is first working with those people who meet in communities in a social context. And you'll find in your community and in different centers, there are elder centers that they meet socially. But those elders also are there, they hold information. They really love when people come in and interview them. And so that was one of my experiences. And elders can also, when you're talking about healthcare, a lot of times they don't understand that they too can change the direction for healthcare through realizing their own inadequacy around using their own tools, the way of eating, because they too been conditioned outside of the original way of living close to nature, living in harmony with life in a healthy way. So a lot of those answers are there sometime in those social gatherings. And so we might want to tap into those as well.
Thank you so much. Mike, super quickly.
I'll do it real quick. I've served and had to bring in home. I'm a scientist and an inventor by profession, but I saw where my mother, who lived to a wonderful age of 98, and I honor Mother Tahirah. That she is my passion, the elders are my passion, but I did not get very good results from some of the organizations when I needed care. My mom traveled a journey of over 35 years of Alzheimer's dementia, and I had to sacrifice my career and my corporation to care for her. And that's when I found myself and my purpose and the success that most people pursue through educations, etc. But that was the greatest meaning of my life. And that's why I'm interested to find out. And I've been also to Ghana, where I've spoken with various tribal people about how in our country, we will file our elderly away into nursing homes and living adult facilities. And I said, I have to do better. And that's where I found myself in becoming a servant to my mother. And God bless her. She went home to be with the Lord few years, and I'm thanking God. That was the best decision of my life I could have made.
Mike, that's such a wonderful thing to share. Thank you so much. And you are a blessing to her, and also pointing the way for all of us. Thank you. So we are at time. I want to thank all of our speakers for sharing this really important message, and a way of pushing back against the way our society thinks. So thank you so much. And I want to close us out with thanks and wishes for well-being.